Across the last 3 years, Centria has been on a mission to fundamentally transform the model of care for our clients, our staff, and the industry.
We will share with you our journey towards assent-based care, the lessons we've learned, and the people we've learned them with.
We're your hosts, Timothy Yeager
and Hillary Laney.
Welcome to the HRE Podcast. Well, Lauren, welcome to the podcast studio.
Happy to be here.
It's so good to see you again.
Yeah, definitely. It's a nice building, ton of plants. I mean, you guys have got it. A good setup.
The people aren't bad either.
Yeah.
Honestly, I'm thinking about like starting a studio on the West Coast, and like who do you want to invite first to talk? Like you were the first name that came on board.
Okay.
OG Central over here.
Yeah. When I think about like our shift and the work that we're doing, like there are a few people that come to mind immediately, and you're one of them. And so I'm glad that we're gonna have this conversation today.
I appreciate that very much. Yeah. I mean, the two of you, I've been so appreciative. I want to let you know that I think about both of you, and this whole ride that I've been on is really because of the two of you too.
And
so
because of you.
I'm happy to be here.
Means a lot. Let's just jump in.
Tell us about yourself first. Tell us about you.
Okay. Well, I'm Lauren. I'm from a small rural town in northern Michigan. Wanted to get out and see the world, so that's what I did. I went to school at Michigan State. After that, immediately I get a job with Centria Healthcare. Back when it was Centria Healthcare, 2016. As a tech, I moved over to Detroit City, and worked in Hamtramck, Detroit, Dearborn, Farmington Hills when we had like a tiny little center there. And I pursued my BCBA. And after that, I remember sitting in the interview and looking at, really what Centria was and how many places we were. And I saw Oregon on the list, and I happened to just mention in the interview, is there any positions out in Oregon? I would move out there. And immediately they were like, yeah, come. I swear, like 3 months after that, COVID hit. So I didn't even really get to see what it was like out here on the West Coast or anything like that. I just moved.
Wow.
I had it in me.
So you became a BCBA?
Yep.
And what's your role now?
Now I'm a DCS, Director of Clinical Services.
Pretty cool.
Yeah.
And before that, you were?
Your CLR, our CLR.
Yeah. You're one of the, like, we just had a post come out recently around like our clinical leadership residency program and the success of that program. And you're one of those.
It was really incredible for me. I think, I try to think of myself as, well, I create plans, in my head, as we all do, of okay, what's my 5-year plan going to be? What's my 3-year plan going to be? And going into the CLR role, I felt like back then when I was interviewing, I'm like, is this too soon really for me to grow in this way? Like I, just moved out here. We had to like struggle through the pandemic. All of us did, And I had in my head of like, okay, I'm going to be a BCBA or a supervising clinician for like 3 years, and then maybe I'll see if I can grow.
Well, and you were like, even told me, I don't even know if I want to be a director.
Yeah. And so when that role came out, I felt very comfortable with you. Obviously, I was very interested in continuing this whole ride of Foundations of Care and SBT, and I just kind of took the leap with the CLR role, and I'm so glad. Yeah. I'm really glad that I did, though. It was outside of my little computed mind of
what your plan was.
Yeah, it's not 3 years until you're
So our plan though was it was you all the time. So
There was no other option.
it was in our mind like
guys.
you were the person that we wanted in that role, and so really glad that you took that step.
I am too. And when I was doing the case reflections or CLR presentations, I was thinking about it and that whole 7-month experience, and how important it was for me to, one, grow in that way, but two, I was really able to develop so many connections with all of the clinicians in the PNW, and that was very important for me. I liked that. And now I feel like I'm part of this whole group within PNW and within the whole group now with Centria. It really brought me part of the company.
A sense of community.
More. Yeah.
That's awesome.
Definitely.
When I think about like our journey and the wild ride that you talked about, it starts like
in the Beaverton Center.
In the Beaverton Center, right? And when we talk about a wild ride, like Hillary just went to Disneyland. Like when you're going up a roller coaster, that click, 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 click at the start, right? Like there's a build up, and
you don't know what's coming.
There's some things that you have to do in order to get to like getting some momentum on this wild ride. And we wouldn't be here today if it wasn't for the success that we had with those first 2 clients.
Yeah, with
right?
you and Lisa.
With you and Lisa. And at that point it was Hillary, right? And
hopes and dreams.
And us flying out to Beaverton and seeing like, can we do this? And I thought maybe we could reflect a little bit and talk about like that initial experience.
I remember getting the email, and I knew a little bit about what PFA and SBT was. I've seen Hanley talk like a couple of times through my grad school program, but it felt very exciting, nerve-wracking, of course, that someone was going to come in and be like, okay, they're going to train you. Yeah. It's Hillary. And I go, okay, who's Hillary? But I just remember that first day. So it was after our initial, meeting in like the hotel and everything, and we're at the center. And just how much like energy was involved in that little room with that little girl and my tech Jamie, who's such a gem, but it felt, I don't know, it felt like something big to me then. And all of us like watching in the break room together too. I really liked that feeling, the energy that was inside after that moment.
It's like magical. It's behavior analysis, and it's like watching our science in live, right?
Yes.
So I remember with your client, her PFA was not clean.
Yeah.
It was very complicated because we couldn't parse out what was going to turn on interfering behavior, and it wasn't very predictable even when we did. So it took us a lot longer than we originally had planned. And I remember you being just like so surprised that the things you thought were going to happen didn't happen. So we had to analyze and change and pivot in the moment.
In the moment. And that's what I really love about this whole process. That little girl, I think about her constantly. She is complex, like as we all are. I think it took me a long time to figure out like truly what she enjoyed in this world. I will never forget that like first experience where I kind of hear her humming, kind of, she's doing, and I'm like, that's 5 Little Ducks. And I start singing it. I go, 5 little ducks went out one day. And the way she turns and looks at me across the room, and this is before she could speak. And we just had that moment together, and I'm like, okay, I know where to start with her a little bit. Powerful. And I just remember within that PFA, like us singing Ansco marching, like up and down and things like that. And I really enjoy that experience of being able to sit there in the moment and just think like, okay, how can I enrich this experience so that I know that they are happy and in this like Zen state of like overall happiness. and start there, and then kind of add in my little, whatever my little things are of the day, my little expectations. And
I love that. That gave me chills.
I know.
That moment when a child or a client who's never really felt like people have entered their world or know how to, that moment when you do, and it's just like this instant, like, wow, is probably one of my favorite things about this job.
Yeah, it does give me chills. I mean, but that's what it's about. And now at the DCS level, it's about that with my staff members and with the clinicians. Just the other day, we celebrated Diwali, and I just like food, so I ordered Indian food. I got a bunch of like Indian desserts and curry and things like that. And one of our technicians accidentally texted the group chat saying like, "Oh my gosh, like my work got all of this stuff. I'm so happy." And it meant to go to, her friends or her parents or something like that. And it went to all of us. And I just kind of sat there of like, oh, this is it. This is that feeling again, like connecting with, somebody by just doing, thinking about them and doing that little thing. It can be a little thing so much as like ordering delivery food, So.
Yeah, we were talking about this earlier. It's like oftentimes in behavior analysis, we talk about the what. Like what reinforcement is, right? Or we have to deliver reinforcement. But the how is often like not looked at, right? And especially when we have complex people that we're working with, either clients or like adults, that how is important.
Yes.
For a learner like her, I'm not trying to call you out in any way, but she's the kind of the learner we started with. She's the kind of learner that people would have quickly moved towards Skittles as a one-to-one reinforcer, because her reinforcers were so hard to define and understand, and they were not easy to give either. And by taking the time to really understand what they were, we were able to create such a potent context that led to some great outcomes for her that Skittles never would have done it, right?
Exactly.
They never would have gotten her there.
Taking that time to, sit and observe and really watch what her interactions with herself are within her world. Like I had to learn, on certain days, if she was singing Five Little Monkeys too quick, like at a quicker tempo, she wasn't quite yet an HRE. She had to do it at this like perfect tempo. Or if she, would line up the monkeys or whatever toy figurine it was that she was acting as the Five Little Monkeys were, if she was repeating the 4, not yet an HRE. I had to like wait and really sit with myself and wait. Yeah. I think that was one thing that I had to learn and that you kept, reminding me about is like, Lauren, just wait to see what she likes and analyze that.
So why was that important? Because if she wasn't doing the tempo right, or she was doing 4 over and over, and you chose to proceed, what was the outcome?
She would get upset. She would be upset with us, and it was hard for her. Her behavior was pretty complex as well. Her interfering behavior was, and we weren't able to, once we passed a certain limit, the emotional badlands or something like that, it was about 45 minutes until she finished a whole routine of this interfering behavior until we could get back to like a happy, relaxed, and engaged point. And so it was very important for me to pay attention to all of those like specifics of that behavior, because if I, tried to push a little bit too much or, just didn't recognize those things, it could quickly go into an interfering behavior where it was the emotional badlands, like state.
Yeah.
And I'd have to wait.
This is a criticism of, skill-based treatment, yes, but assent-based care as a whole of staying in that place where I don't even think waiting is even the right term, because there is teaching and learning happening in the context where we're trying to get HRE. But there's a criticism of that, like you're not doing anything. And I think it's a valuable lesson, and it's not always like that for every learner that it's 45 minutes, but it is a valuable lesson that, do we want to spend that 20 minutes really getting to a place where we're stable, or do we want to spend that hour managing through a difficult moment where we're learning other things, but they're not the things we want to be learning.
And our kids in distress.
And I mean, I think those people who really, not trying to talk, I don't want to say anything bad about anyone, but for some of us in this field, like the feeling of wanting people to be happy is enough for us to want to do this work. And I'm not saying that people don't care about that, but the outcome they want to achieve kind of is over that feeling, right? The want to do the science and the want to get the outcome overrides any potential risk to the learner in those situations, which could be appropriate in some contexts. But for others, knowing the logic behind the learning and how the science is actually playing out in those moments can make the difference, right? So the difference of I'm spending this time engaged in managing interfering behavior, or I'm spending this time teaching a client how to self-regulate. Like we can look at the science in those contexts and make different decisions.
And we're building a relationship at the same time. Our interactions with her grew. She started to look towards us more. I mean, she wanted us around, started to say our names, like recognized when we would sit next to her because we allowed her to be in her space. And that's definitely like one thing I want to emphasize to everybody is that it is worth it.
It is. And those are like level 1 VB map skills that you didn't have to do discrete
teach at a table
trials to achieve.
One thing that Hillary I'm thinking about is I think there's another reason in which people may avoid like this type of work is if you think about like ABA, what ABA was for my practice, there's a sense of control, right? And really what you guys are talking about is a sense of like trust and like what's required in therapeutic alliance is a journey of two people. And I don't have complete control over that journey altogether. And I have to sit in a very uncomfortable position at times and accept that. Right, that I may not know what to do right now. I may not know how to get to that end goal, and I'm not gonna like force it upon someone. I think that's a big step it was a big step for me as a behavior analyst. But our data suggests that you get there, and you often get there quicker.
Yeah, and more safely.
Yeah,
that's and that right there, like being able to. Could you phrase that again?
Yeah, like just sit in
the discomfort a little bit,
right? Like because you're not in control, right? You're like in those moments, and this is what I think it was what you said that was beautiful about it. What you said, which was there's a lot of nuance to our science, and I think that what I've seen is this mentorship has like really elevated the skill set of our behavior analysts to understand that nuance. And people on the outside look at our science, and I think rightfully so, like look at it as if it's very simple and judge like to some degree of what we do because they don't get the nuance or people aren't practicing with that type of analysis and nuance. And what you described and the ability to understand this client, their needs, what she wanted, what she liked, like allows you to take a step back and be like, I don't really know right now. And that's okay, but I'm going to sit here in this discomfort and try to figure it out.
I think right there is what has developed, just me as a clinician the most is being able to understand that I can sit in the discomfort even if there's eyes just like watching me and there's an interfering behavior happening.
And it's uncomfortable.
I think before, it's a science-based field, right? And so I'm like,
everyone's watching, I got to do something.
Yeah, I'm supposed to have the answer and I'm supposed to, understand behavior and be the expert in this field and why isn't it stopping and all of those things. And having the confidence to sit in the discomfort is incredible.
It is. We went through the learning together with SBT, and I think what you're describing is why the foundational plan is so impactful, because the foundational plan really encourages us to pay attention to the synthesized reinforcement contingency and the needs of our learner and how to set them up for better success. What have you found is the difference between like a straight, I'm going to do SBT with this client versus let's get a foundational plan in place and then move to SBT?
I think it's incredible of how impactful the foundational plan can be and just the foundations of care. when I just moved into the DCS role in September, there was a little girl on my radar who we're potentially talking about moving to in-home therapy because we're not sure that the center environment's appropriate for her. But we got a foundational plan in place. We started to understand, truly what her synthesized reinforcement was, like, and what certain boundaries would be. And so then we know, okay, we just can't put things in our mouth. We do have certain areas where she prefers, and we make sure that the room is, not that many clients in there, something like that, where she can just fully be herself. We lifted arbitrary boundaries of, potentially needing to wear her shoes like all the way in the hall, maybe in the hallway, but she doesn't need them in the room or something like that. And now her interfering behavior has significantly decreased, where I'm even questioning if we need to continue with SBT.
That's great.
So, period. There, we just start.
Yeah, it's actually a great question because you've been, part of this journey is when we started with you in Beaverton on that day, which I really think about this, which is
Timothy thought SBT saved the world.
Yeah, right. So I thought that we're just gonna do PFA and SBT for all, right? Just like Oprah, just give it out to everybody, right? And
like Oprah,
you get SBT, you get SBT, everybody gets SBT. But we pivoted, and so I thought maybe you could talk a little bit about the impact of the foundational plan. So going from PFA SBT, which was our initial plan, right, to then we came up this universal protocol, and how you've seen that shift in the practice of your clients, your clinicians, and now you as a director.
I'd also like to add that we made you go through mentorship twice.
Yeah. I think what helped me the most was our second or third maybe client that we went through. The little boy. And he had several rigidities. I also couldn't quite figure out, he couldn't communicate with me what he wanted me to do with certain routines and things like that. So unfortunately I had to hold boundaries of just I don't know what you want right now, buddy, but I've just got to keep you safe. And aspects of that have just fully, helped my practice as a clinician. And I think starting there of just identifying really what expectations we need to hold, I think helping clinicians let go of some of that. It's yes, we have these learning opportunities that are sitting here, but if we start from a place where I was saying before of figuring out those nuances, what are absolutes, start there first, and then we can, move forward. I think, I don't know, it's just been incredible. I think of a couple of clients right now. I have a little girl who won't drink any liquids, has been through feeding therapy, all of these things. And, I said, okay, I'm not touching that necessarily, but what I am going to do is just have a cup of water next to her when she's drinking, and just if she ever wants to drink it, she can have it. We started just kind of playing with the water, having bubbles with the water. Now she's fully singing, take a drink, do, 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 the rhythm of Baby Shark, and picking up the glass of water and putting it to her mouth. Wow. And I never had that as a demand. And so, I don't know, taking certain aspects of, our foundations like that, where it's just be fun, be enriching, figure out your boundaries, and know your protocol when you do have to hold those boundaries makes, that is something I didn't even program for, that this little girl was going to drink. Or that this little boy, I didn't even yet program that he'll transition to multiple rooms. But he did, because he knew that I was a safe person after a while, because I helped him through all of those times where he was distressed or something like that. I just sat with him.
I think that's something that's really missed in the assent-based care model, is not missed. I want to rephrase that, but not talked about enough or explicitly trained or even published right now within our literature, but it is in the psychology literature, which is walking with someone through difficult moments in a way that's supportive of their dignity and compassionate towards them and empathetic towards what they're experiencing is more powerful than joining them in an HRE, right? Like, I use this example a lot, but when you go through something really terrible in your life, who do you call? You don't call your friends you go to Vegas with to have a good time, right? Those are the good time people. You call the person who can see you disheveled, who can help you through that moment and be with you in a way that you prefer because they know you so well and they've shown you that you can trust them during those times.
Yeah, you become their
Safety net.
safe person.
Yeah.
And yeah, I think in new scenarios, especially for our kids who struggle with unexpected changes and changes in routine, if you show them that you're their safe person, it just comes with it.
Yeah.
Comes with it all.
You may have just flipped the paradigm of like what people think parenting is,
It is true,
right?
right?
Just like following a kid around
Yeah.
with no demands.
It's true.
Right.
And I also think when I talk about going through a challenging moment, that challenging moment has to be something that it can't be for nothing, right? I'm not gonna follow you through a challenging moment where I'm making you match colors.
Right.
I'm talking about a boundary where, like, I am so sorry. If I could change this for you, I would. If I could control this and make it better for you, I would. And I can't. And I can be here with you through that. Like, I can't change that. Your red cup is in the garbage now.
Yeah.
You want the red cup, but I only have the blue cup. I'm really sorry about that. You know, but I can change that. I'm asking you to work at the table for an hour.
Right.
We hear sirens going on right now, and it's the dogmatic extinction-based behavior analysts out there that are just trying to come for us.
And boundaries are an extinction procedure.
Yeah.
But done in a much different way. They can be done in a much different way.
Yep.
Yeah. How are you different as a result of like the mentorship program and like this Foundations of Care like rollout?
I think I'm more confident, in
You
general. Well, and, in general, I'm a shy person. I think I said before, I'm like very rule governed on the inside. And, I wanted to follow all the rules. I was taught how to be a behavior analyst a certain way. We all read the big book. We all have the big pass the ABA exam type of thing, reading the scenarios. And I have been able to go into situations where, I can be a little bit more flexible, or I'm not as afraid if it is like a complex case or something like that. I'm willing to like shake myself up a little bit. Where even when I was learning SBT, I know that I wanted to fully understand what CAB 1 was, before I'm like, are you sure I should go to CAB 2? Because I want to know really what this is. And so I think that part of myself has really loosened up a bit. But at the same time of loosening myself up, it's given that confidence to do it and go into it.
We missed our first question.
Yeah.
What is your HRE?
I've been waiting for this one. And it's almost, so my HRE is sitting in front of the TV on Saturday morning or something like that. And I've got a beautiful travel vlog playing on YouTube. I'm very into travel. And right now I'm planning a trip to Vietnam. And
You just went to Thailand, right?
I just went to Thailand. I just went to Norway in June. I plan out full itineraries for 2 weeks. I've got all of the days. I do deep dives on where the best food is, most authentic pho place in Hanoi, Vietnam. I'll fully dive in. And that makes me happy. So maybe a couple beverages out or something like that, but it's really the travel.
So the vlog's playing, you're planning
the
it.
planning for the travel.
The planning for the travel specifically, yes.
Is the travel itself your HRE too?
Of course, yeah. But, with travel comes, maybe a restaurant was disappointing or something like that, or I missed, or, the park is too far away to go before this. But the planning is really fun for me because I just get to kind of explore each of these countries and cities specifically and cultures all at the same time. So
That's great.
yeah.
So you've been a tech for us. You a BCBA, a CLR, a DCS. For those watching that aren't with Centria, like why should a BCBA join Centria?
Oh, that's a good question. Well, I think Centria is doing a great job building a community within each of those small markets. And even if we are a big company, I really do appreciate that we are standardizing our practices, especially with, like the foundations of care and SBT. And I think within that helps, that sense of that part of community where I can like look at my coworker and say, okay, will you look at my case? Am I on the right path or something like that? Because we're all practicing similarly. And so I think that sense of community is really
builds
grown.
a lot of trust.
Yeah. A lot of trust. And I feel comfortable, with someone else looking at my cases and things like that because of
the lens.
Yeah, that we've built, that you guys have built.
We found that at our centers as well, in which when you have a common approach to care delivery, that type of collaboration at the BCBA level, at the technician level, right when a client's struggling, like anyone in that space can come and help because they understand like what the protocol is and how we're going to help support these and like what the values are that we need to maintain alignment with.
Absolutely. I've got my 3 BCBAs back in Beaverton right now, and I'm comfortable. I know when there's a situation that they would practice similarly to me, like give my technicians like the same advice and follow up, and I wouldn't, bat my eye or something like that of what they said because we talk about
it. Speaking of Beaverton, you have 3 BCBAs back there.
Yep.
We're like tripling the size of the center.
I think so. At least it's a little while away. I think it was pushed, but
a few months out.
Yeah.
What's your thoughts around like a growing center and like that's going to be your responsibility as a director?
I think
going from like 3 to like maybe 7 or 8 BCBAs.
Yeah. I think I'm happy to start here and like grow with it, but it is exciting to me. I mean, I think I've started at the Beaverton Center. I had one case there, and then it developed into a center-based BCBA, and so that location specifically has like a piece in my heart, and I'm glad to see that it's able to grow. Yeah. And thinking about how many kids are running in the center, like
100.
Yeah.
Yeah.
A lot of baby shark, a lot of bubbles. That's okay. I mean,
it's gonna be great.
Yeah.
We also rolled out tech training in Beaverton first. And so we have a new technician training that's in person and fully aligned to Ascent-based care and the foundations of care.
Yes.
What have you noticed about the technicians coming through that training?
They definitely engage in much more of the lingo. They'll ask me about, I don't know if they'll use the phrase like synthesized reinforcement, but especially HRE. And I've noticed that they spend the time thinking about that a lot more when they first start with their clients. Or I even had a technician start with a client, and she asked what certain boundaries were at the center.
Oh, that's
already
great.
Starting with that, where I'm like, thank you for asking that question, because I know that you are brand new here and this client is brand new here. And so you're going to come up with, certain things just because we're in a facility,
sure.
But I it's just as a clinician, hearing those words come out of a technician it lifts a weight off of your shoulders. So
it's a level of training you don't have to provide.
Yeah. And shout out to our trainers there. I mean, those 2 girls are
one of them was one of our first PFAs.
Yes, that's true. So she's
Amber
able to grow.
Yeah, Amber's one of our trainers in PNW, and she was our first PFA with Lisa's client.
She was a tech?
Yeah, with Lisa's client. Yeah.
Oh, that's cool.
The one you ask about all the time.
Yep.
Graduated.
Yeah.
Yes. The client graduated.
Yep. Yeah, it has been incredible. I think the technicians feel a sense that they're able to, I think, just talk to us a little bit more about the cases too. I know, when I started, it was, and maybe that's just me because I'm shy, but I don't think so. I think I noticed this just several years ago where techs would just kind of keep to themselves and, not really make any choices until the BCBA said something, or if they did make choices, they're not, I don't know, they could be wild or something like that, but they're speaking up about like their thoughts more. I think they're reflecting and engaging in decision making out loud before, or like while the BCBA is there. So it gives them, some more of that confidence too.
It's incredible. That's one of the things that we've noticed. I think one of the beauties of the foundational plan is that it should empower a technician on how to like safely, kindly handle crisis, right? And when you think about managing a center, when a center can be at times mismanaged and or doesn't have common language or doesn't have those plans in place, BCBAs often feel pulled in all the different directions, right? But the fact that we can like start to empower technicians to like be part of the clinical care team, be able to make decisions in line with like the scope of their practice. And here's a plan that fully empowers you. Like if these things happen, just make sure the client gets back to HRE and do it safely and kindly, and then we'll do the analysis.
That's exactly the text I sent to my techs, where I said, okay, I'm going to be in Fresno for a couple days. You know what to do in a high intensity situation, and I love that I'm able to empower them in that way because I've got their plans laid out, they've practiced it. And I try to just remind them, throughout my practice, but they're able to feel that sense of empowerment too. Like when I'm able, when I can say that to them. It's been really fun lately. I just did a all behavior technician, Beaverton Center behavior tech meeting. And I was able to do like a bit of a clinical like deep dive. And I'm starting with synthesized reinforcement and HRE. And so we're going around and talking about, that same question, like what does your synthesized reinforcement looks like? And what do you do like when you're in HRE? And I then that day, of course, I made the silly example of my perfect like morning routine while we had a 7 a.m. meeting. And so all of my texts...
This isn't my HR.
Of course. And then I get to the center and they're like, Lauren, you interrupted my HRE this morning. Like, I know, guys. But just the fact that they're engaging in that language is so incredible. And I don't know. I'm very proud of them.
That's awesome.
Yeah.
So what's next for you? What's in your future?
Well, I've got my Vietnam trip in March. What's next in my future? I do want to, I'm interested in maybe attending some more conferences. I remember feeling that same energy when we went to UCP. Was it 2 years ago?
2 years ago.
2 years ago in July. So I think, that might be next for me to continue some of that because again, that ignited that feeling of, just energy within me of our first like PFA and things like that. And just coming as a team too was incredible. Yeah.
We need to link.
Powerful.
We need to link somehow your What Would Hillary Do?
Yes, hats. The hats. I still have it in the closet.
Oh my gosh, I love it.
Oh man.
Yeah. Awesome. Well, thank you for coming down here.
Yeah, of
course.
course.
Thank you for the work that you
to you,
do. I always enjoy our time together.
Yeah, thank you. And West Coast, I mean, we've got to hold it down.
Yeah. Awesome. And that concludes another episode of the HRE podcast.
Thanks for listening. If the HRE podcast is a part of your synthesized reinforcers, let us know what else would make the perfect reinforcement context for you in the comments below, and join us next time.